When we talk about the bones of the thorax, we have to talk about the ribs. The ribs are 12 sets of bones present on the left and right side. And as you'll notice, as we move from ribs 1, 2, all the way down to 11 and 12, they change their appearance pretty drastically. Ribs 1 and 2 are relatively flat and broad. They have some small bumps on their superior surface for articulation with what are called the scalene muscles. The ribs expand out further and further as we go, and notice that each rib takes a bit of a posterior course as it then loops laterally to anteriorly. By the time we get to the 11th and 12th ribs, there's not a whole lot left other than kind of that strut of bone and not too many other surface features. One way to keep track of what's happening with each rib is to pick one of these ribs in the middle. We're actually going to go with rib number 6 and treat it as what we're going to call a generic rib. So let's take a look at some of the features of this rib that kind of stand in for every rib. So zooming in, let's get right back there. Here, first thing you'll note is that we have an area that articulates with the thoracic vertebra. So this is going to be the head, and you're going to have a costal facet present here articulating with that vertebra. The head of the rib gives way to the neck, this next area progressing laterally, and as we go we run into a roughened area called the tubercle. So the tubercle is where we have articulation with the transverse processes of the thoracic vertebra, as well as quite a bit of ligamentous attachment. So from the head to the neck to the tubercle, we then progress around the body of the rib, and this takes us all the way to the anterior surface. Now along the way, one thing to note is that the rib actually doesn't just go lateral, it actually scooches posteriorly before turning anteriorly, and this makes the costal angle, that posterior expansion of the ribs that you can palpate. Secondly, on its inferior surface there's actually a groove, thankfully mercifully named something sensible, the costal groove, and this is going to be where the neurovascular bundle, the interosseous artery, vein, and nerve are going to be hanging out just inside that costal groove and just inferior to it. And that takes care of most of the features of the vertebra. Notice there's a roughened area here anteriorly. That's where the cartilage, costal cartilage, would have been during life. That would connect it to the sternum. Now the sternum is actually 3 bones that fuse at varying times in our life, but a lot of us actually have separate sternal bones. The top or superior one is called the manubrium. Then we have our sternal body, and extending down from it is the xiphoid cartilage, which often will ossify or turn to bone as well we proceed through life. Taking a look at it here, you can see the manubrium and sternum meet at what's called the sternal angle, this area just here. The manubrium itself has a few notches that are important. We've got the jugular notch superiorly, and that's going to be an important palpatory landmark. So midline, the jugular notch. Then we have 2 places where the clavicles are going to articulate. These are the clavicular notches, and as we go down the lateral side of the sternum, we can see where the ribs are going to articulate with it by way of their costal cartilages. We will finish up our view of the skeleton by moving on to the thorax, the abdomen, and the pelvis. In the process, we're going to be looking at a few things we have already seen. So we're going to start in the thorax, and just remind you that we have the thoracic vertebra, 12 of those right here, connecting to the ribs, 12 ribs on the left and right coming down. We have in front, or anteriorly, a continuation of the ribs. That is the costal cartilages that are extending from their anterior surface to the sternum, which we can see right here, made of the manubrium, the sternal body, and the xiphoid process. I want you to note that ribs 1, 2, 3, 4, 5, 6, 7 all attach directly to the sternum. These are called true ribs, whereas the false ribs are the remaining ribs 8, 9, 10, 11, and 12. They do not attach directly to the sternum, but instead their costal cartilages, in the case of 8 through 10, meet up with the costal cartilage of the rib above them, and ribs 11 and 12 are called floating ribs because they do not connect to the sternum at all. One thing I do want to note is that these models get quite right is that ribs 11 and 12 do have costal cartilages on them usually. They just don't survive the process of being dried out and mounted like we have on the ribs, the sternum, and the thoracic vertebra all together. We can see that there are two major holes in the thorax. We have the superior thoracic aperture just here, and the much larger inferior thoracic aperture here, kind of moving in from where we have the thoracic organs into the abdominal organs. While we're here, let's take a quick look at the ribs once again, and note that the head of a rib, tucked in way back here, is going to articulate with the costal facets or demifacets of a thoracic vertebra. Then we have the costal neck, the costal tubercle, interacting with the transverse process there. Then we have the body or shaft of the rib coming forward, a costal groove on its underneath inferior medial side, before we finally get to the costal cartilage and the sternum once again. Going back to the sternum, note we've got our jugular notch here, and now we can see the clavicle articulating with it at the clavicular notch and the sternal angle where, pardon me, we have the sternum and manubrium articulating. The manubrium gets to articulate exclusively with rib 1, whereas rib 2 is shared between the manubrium and the sternum, and then 3, 4, 5, 6, 7 are going to attach to the sternum directly, and as we noted before, the false ribs 8 through 10 will be articulating with the costal cartilage superior to them. Moving to the abdomen, we don't have a whole lot new to look at. We have lumbar vertebra, which we've already seen in the section on the back. To review quickly, the lumbar vertebrae have a large spinous process. Then we have on either side a transverse process. The two are connected by the lamina across the posterior side of the vertebra, and pedicles connect the transverse processes to the vertebral bodies. We have a superior and inferior articular facet with each one of these coming off their articular processes superiorly and inferiorly, and the vertebral bodies are just here and separated by intervertebral discs. Now as we move down to the sacrum, it's a little bit difficult to see here, so I'd like you to review the sacrum in the back video, but on the anterior side we do have some anterior sacral foramina where nerves are coming out. If we flip to the posterior side, it's a little easier to see the posterior sacral foramina just here, and we have a continuation of the spinous processes. This is the median sacral crest. Just medial to those posterior sacral foramina is the intermediate sacral crest, and lateral to them, big surprise, is the lateral sacral crest. Extending inferiorly off the sacrum here, let me scooch a little lower if my knees will let me, we have the coccyx, or the tailbone, with its very stunted transverse processes and some cornua on the sacral side, sacral cornua, and the coccygeal cornua here, marking where there would be an opening in a real bone for the sacral hiatus, allowing us to access the spinal cord and the nerve roots that make up the cauda equina within it. Now that we've taken a closer look at the sacrum once again, let's see the rest of the bony pelvis, which is made of the three fused hip bones, or os coxae, the ilium, the ischium, and more anteriorly we have the pubic bones on each side. So the ilium has this large wing, or ala, just here, and that is going to be where the iliacus muscle is hanging out on the inside in the iliac fossa, whereas on the lateral side we have the large gluteal fossa for the gluteus medius and minimus muscles just here. The iliac crest is this very large roughened area right here where the abdominal oblique muscles are going to attach, and it terminates at the anterior superior iliac spine. Then below that we have the anterior inferior iliac spine. Posteriorly, once again, if you haven't reviewed the lower limb, we mentioned it there too, but we have the posterior superior iliac spine and the posterior inferior iliac spine, leading to the greater sciatic notch just here. Now that greater sciatic notch ends at the ischial right there, and at that point we've transitioned to the ischium. So we've got the ischial spine, then the lesser sciatic notch just there, and finally we've got this large tuberosity, the ischial tuberosity. You can take a closer look at that right down here, and that's where the hamstrings are going to attach. Now from that ischial tuberosity, we have an ischial ramus stretching forward to meet the pelvic, or the anterior part of the pelvic bone, the pubis. So just here we have the inferior pubic ramus, superior pubic ramus, and sometimes these are called together the ischiopubic ramus down here. So inferior pubic ramus plus ischial ramus are sometimes called the ischiopubic ramus. Just there, we have the obturator foramen formed by the pubic bone and the ischium, just there. The pubic symphysis is where those two bones come together. So we have the right and left pubic bones meeting at this fibrocartilage structure that is the pubic symphysis, just there. And there's a large bump on either side called the pubic tubercle. Last but not least, there's a nice large eminence here called the iliopubic eminence. And now that we have all these bones together, we can see this outline here called the arcuate line, going all the way around, separating the bones that are superior, called the false pelvis, with the wing of the ilium here, from the true pelvis, which is completely surrounded by bone. So the true pelvis is deeper, false pelvis is superior to here, and just like we mentioned in the lower limb video, one last but important structure to note is the acetabulum, where we have the head of the femur articulating with the hip bone.